A laboratory technique called fluorescence in situ hybridization, or FISH, can be used to diagnose chromosomal abnormalities such as the 22q11 deletion. On the left here, we can see normal cell nuclei which are being stained with probes that target specific chromosomal regions. The red probe targets 22q11, and the green one is for a part of an unaffected chromosome. It's basically being used as a control here. Notice that there are 2 red dots and 2 green dots, since there are 2 copies of each chromosome. Now on the right, we're seeing a patient with this disease. Here we can see that there's only 1 red dot instead of 2, which means that the other chromosome has a deletion at this region. Deletions involving chromosome 22 at q11 can lead to several symptoms due to dysfunctional development of the 3rd and 4th branchial pouches. So what do these 3rd and 4th branchial pouches do? Well, as we'll talk about in the reproductive chapter, the 3rd branchial pouch develops into the inferior parathyroids and the thymus, and the 4th branchial pouch develops into the superior parathyroids. And as a review, what do the parathyroids and thymus do? These are involved in calcium homeostasis and T-cell maturation, right? So if you don't develop these organs properly, you'll have problems with calcium homeostasis and T-cell development. Now, as you can imagine, depending on how much of this region is deleted, you might see slightly different phenotypes in different affected patients, and an error in 3rd and 4th branchial pouch development might cause some of the surrounding structures to develop improperly as well. So the variable presentation of this syndrome includes a cleft palate, abnormal facial features, thymic aplasia, which again causes a T-cell deficiency, cardiac defects, and hypocalcemia secondary to parathyroid aplasia. You can remember these using the mnemonic catch-22, since again this is the chromosome 22 deletion. DiGeorge syndrome includes the thymic, parathyroid, and cardiac defects, while velocardiofacial syndrome includes basically everything except for the thymic and parathyroid defects, so that would be just the palate, facial, and cardiac defects.